Hello everyone, welcome again to my channel. I am Dr. Zina, full-time dentist. Today we'll be talking about how to manage a broken file inside a canal and what are the tips to avoid as well. But before we continue, make sure to smash the subscribe button down below because it would really help me to do more and more videos. Here is a picture showing there is a broken file inside the canal. Why do fires break? Fires break due to cyclic fatigue and torsional stress. So what are the tips to avoid breaking a file inside a canal? Very important is to never sterilize the fires. Always get a new fires with your patients. Never ever sterilize the fires because there is a 90% chance the fires will break inside the canal because they will become very, very weak and fragile. Use one file for each canal. My advice to you, not to use the same file for all canals, because the file might become dull and it can break in one of the canals. So always use one file for each canal. Very important is to do irrigation continuously. Whenever the file is out, do irrigation before you insert the file. So irrigation, file, in, out, multiple times irrigation continuously. Never force the files in. Let the files move smoothly inside or enter smoothly inside the canals so that it will not break. Lastly, always start with hand files to create glide path. Glide path is having a straight line access before using rotary so that you will not break any instrument inside the canal, which are the rotary files, so that the rotary files will not break inside the canal. Now, what if the file breaks inside the canal? What is the treatment in this case? We have an option that is surgery to be done by an endodontist only. And when we will do it, if the broken file is beyond the apex, then we will do surgery in this case because there is a risk of contamination that will take place. And the second thing we can do is bypass. As you can see in the picture, there is a broken file inside the canal, but the doctor, he bypassed this broken file, and the result came out good. There is no any radiolucency in the periapical area after 6 months, so it is a good result. And the last option we have is you can remove the broken file by using a fine ultrasonic tips that will be done only by endodontists. It's easy to remove with the fine ultrasonic tips any broken file inside the canal. And some of you, I'm sure they will ask, will the patient feel pain if there is a broken file inside the canal? No. No pain will arise with a broken instrument unless this broken file is beyond the apex. Then surely he will have pain on biting because when he bites an occlusion, there will be something that will press against the bone or on the bone, which will cause pain on biting only. But of course, you need to inform your patient if there is any broken file inside the canal. Very important is to have veracity. Veracity is telling the truth to your patients. You need to always be honest with your patients. If you break a file, tell him that you broke a file and tell him, will this end in a good result, or what if happens, what exactly, etc.